1 in 4 adults will have a stroke in their lifetime, and one of the risks of stroke is hypertension. Professor Valery Feigin, tell us, what is hypertension? How is it connected to stroke? And how can we avoid or manage hypertension?
All right. Hypertension or elevated blood pressure is the single most important risk factor for stroke. It is responsible for stroke in about 65 to 70% of cases. And hypertension or elevated blood pressure is defined by the systolic blood pressure 120 or greater, or diastolic blood pressure or low-level blood pressure of 80 or greater. The criteria for elevated blood pressure have evolved over time quite substantially. 30 years ago, it was 160 systolic, that was regarded elevated blood pressure, and 95 diastolic. Now you can see the figures are much lower because we have now very strong evidence that even from the level of 120 systolic blood pressure, the risk of stroke is going up. And the reason why elevated blood pressure increases the risk of stroke is severalfold. One of the main mechanisms is that elevated blood pressure causes hardening of the arteries, particularly very tiny, small arteries in the body, including brain. And with hardening, it comes a lower level of blood supply to the brain, and over time, it may cause insufficiency of the brain blood supply. The other mechanism is spasm of the arteries caused by elevated blood pressure. As spasm of the arteries also causes lack of the blood supply to the particular part of the brain, and that also causes stroke, may cause a stroke. Hypertension is also known to accelerate the rate of atherosclerosis. We will talk about that later, which is also a very important mechanism of stroke. Elevated blood pressure also causes changes in the functioning of the heart, which is also an important mechanism of stroke. So how to treat or avoid hypertension? Of course, the best way is to avoid it. In the only proven way to avoid hypertension is a very healthy lifestyle from the very, very early age, actually from conception. When mother and father are healthier, that's a big predisposing factor. If one of your parents has hypertension, elevated blood pressure, you are also at risk. It doesn't need to be developed into hypertension, but the risk is increased, and you need to be particularly careful about healthy lifestyle. Follow all healthy lifestyle recommendations: diet, physical activity, avoiding smoking. There are a number of, we can talk about that later. That's the best way to avoid hypertension. How to treat hypertension? Initial treatment of hypertension involves, again, normalization of your lifestyle, sleep pattern, diet, physical activity, reduce your weight. If all these lifestyle measures are not effective and your blood pressure is not terribly high, you can try it for about 2-3 months. If it works, then just carry on. and just follow all these healthy diet, healthy lifestyle recommendations. If it does not work and your blood pressure is still elevated, and elevated I mean over 120 on the average, for elderly people, senior people, this level may be higher, 130, and in some cases even 140. But when it's still over the desirable level, which is defined by your doctor, then your doctor usually prescribes you blood pressure lowering medications. And these medications are for lifetime. Modern blood pressure lowering medications have very low level of side effects. They are very well tolerated. There are a range of blood pressure lowering medications. If one does not work, then your doctor may switch to another. There are different combinations of blood pressure. In 95% of all cases of elevated blood pressure can be effectively controlled.
That's great, and that's the most important thing, controlling your blood pressure. Thank you, Professor Feigin. So get your blood pressure checked, people. You can ask your GP to do it for you. Most of your local pharmacies in your area do it either for free or for a small fee as well, so you don't necessarily have to go to your GP. Have a look at our Don't Be the One NZ stroke prevention campaign on our website. There's more info there as well on all the different stroke risks. www.strokecentral.org.nz, or visit our Facebook page for regular updates and more info. So, as we know, stroke prevention is key, so get yourself checked out. Thank you.